Broke just this morning that a case of measles is confirmed in the state of Nebraska. A child in the Panhandle has tested positive for the disease. Now, the health department is only sharing the child has not been out of state recently and is vaccinated for their age, which could be one or both doses depending on the child's age. As for now, health officials are stressing that it's important to remain calm. Measles is one of the most dangerous diseases for young children and, of course, infants, as it is the most infectious disease known to man. This infection can lead to some serious side effects and in rare cases could even cause death.
We know that about 1 out of every 5 people who get measles will be hospitalized. 1 out of every 20 children with measles will get pneumonia, which is the most common cause of death from measles in young children. 1 out of every 1,000 people with measles will develop brain swelling, which can lead to brain damage. And about 1 out of every 1,000 people with measles, up to 3 out of every 1,000 people with measles could die from the complications.
Chief Medical Officer for the Nebraska Department of Health and Human Services says that because this patient has not been out of the state, there are likely other people with measles in the state of Nebraska.
We're very, very early in this investigation, so we really don't have a definitive answer on that yet. We don't really even have any definitive numbers of people that may have been exposed. We are working very closely, as I said, with the local health department and the regional hospitals to begin that contact tracing, contact investigation.
And that was Dr. Tesmer. He added the best cure for measles is prevention, which is the vaccination for this disease. And he shared the vaccine is 97% effective in minimizing impacts from measles.